how Mombasa Port became the epicenter of the virus. Yesterday is one of the days that we see Mombasa recording the highest number in terms of increase in the country, and a good number of that is linked to the port. So, of course, questions are being asked, why the port? But it's also the logistical way that the port is set up, and as a result, we have a spread that is going on there, which is, of course, a cause of concern.
Yeah, absolutely. And the governor has been quoted in the Daily Nation on the same particular story, having said that this is sheer irresponsibility and recklessness. That's what he's blaming on that. But he did also say that these people interact with us. But I guess what he means are the people who have traveled far and wide, because the port is an entry point for goods and, a lot of cargo. So when the people at the port interact with their counterparts, maybe that is the entry point. Because now they're at 71. That is the second largest number originating from a city, the first obviously being Nairobi. And so this is a big issue and one of concern. And speaking of, what do we call it, recklessness, as the county governor would put it, another county has been highlighted this morning, and this is Meru, where the governor, Kiraitu Murungi, is seen there putting some efforts, I guess, into the fight against coronavirus. But the question that has been posed on the front page of the Daily Nation this morning is what social distancing, how not to fight COVID-19. And we look at that picture, then you'll understand what the editors were meant when they put this title here, because it is a crowd. They're all masked, really, but then at the same time, this is quite dangerous if you do think about how that virus has been termed as airborne, and at the same time, it can be transmitted via touch and, close contact. What do you make of this picture, Mike?
Well, evidently, they are, like the nation has mentioned, taking 3 steps forward and 5 backwards. And this is because they are doing a good thing by providing water and tanks for people to wash their hands, as provided in the guidance of the Ministry of Health. But again, contravening some of the rules and regulations given by the Ministry of Health, and one of them being gathering. We see people that are gathered together. Of course, no social distancing whatsoever exercised in this particular case, and one would expect that Governor Kiraitu Murungi would be one who would be very, very aware and alert to ensure that this does not happen. But there you go. Some of the things that we're doing that completely contravene the guidelines that have been given. But let's go back to the Standard. And on page 7 of the Standards, those we call frontliners, but we have medics now asking for risk commuter allowance in an amount that is totaling 45,000. They're requesting to have 30,000 risk allowance, 15,000 commuter allowance, medical insurance, extensive medical insurance. And this, of course, would be understandable given that they are the ones at the front line and bear the brunt in terms of having high risk of possibly contracting the coronavirus, COVID-19.
Yeah, and of course, there's a list of demands right there. We have risk allowance at 30,000, 15,000 commuter allowance, medical insurance is what they're asking for, logistical support, including transport, meals, and accommodation. And then they're asking, their demands also include the revision of employment contracts, government to fast-track the employment of 6,000 more medics. And of course, this would be something that is very crucial right now. At the same time, security for those working during curfew. I mean, I'll take the case of Uganda. They do have, well, this was philanthropic efforts, but they do have buses that actually volunteer to take these medics back home every evening. So they are cushioned in terms of that worry going home after hours when there's a curfew, and there's probably a likelihood of being harassed, knowing African security people and what we have seen trending in the news.
Yes, the other thing that they've also requested for is the addition of 6,000 more medics, and this, of course, has been an ongoing conversation, given that the health sector is heavily understaffed. So you can imagine now with COVID-19 bringing us to such levels of testing our health system, then they have a valid cause right there. But